Well, I'd like to introduce St. Louis, and in fact the entire Midwest region of the United States, to a brand new technology that I think is going to revolutionize the way we look for prostate cancer in a man's prostate and the way we biopsy his prostate. This is called the ExactVu micro ultrasound system. And not to get too technical about it, but it takes pictures of the prostate using a frequency of 29 megahertz. The standard type of ultrasound that urologists have been using for decades is only about 5 megahertz of frequency. Consequently, this higher frequency ultrasound is able to provide much more detailed images of what's going on into the prostate and can see the precise location of most prostate cancers in a way that's at least as good as the MRI scan can. And because this ultrasound can be done in the doctor's office at a lower cost than an MRI scan, which also has some disadvantages for patients who are claustrophobic or for patients who have pacemakers or other implanted metal devices who cannot have an MRI scan of the prostate. This, in fact, seems to be a better option for many men who have an elevated PSA. So, when a doctor performs a needle biopsy of the prostate without this more accurate imaging, he or she places a needle through the rectum and right to the lowest edge of the prostate, which you could see right here, and then takes the biopsy. And that needle will extend about 3/4 of an inch into the prostate. And that's a pretty good way of assessing what we call the back half of the prostate. But guess what? This patient has an abnormality in this part of the prostate up here. So even if that needle was right on track and the doctor placed it at the correct angle and fired it into the prostate, it would only reach this far. It would not have reached this concerning area. But with this technology, now we can advance the needle right up to the edge of what we see as abnormal, press the button, and that biopsy core will go right through the most worrisome part of the prostate. And that's why the detection rates, the accuracy of finding a cancer within the prostate, if there is one, is much higher with an image-guided biopsy using this technology and or MRI scanning of the prostate. And this is the strength of having real image-guided biopsy of the prostate. We have turned the detection of prostate cancer into something similar to what women have when they undergo mammography to look for breast cancer. So if a woman has a mammogram and there's a suspicious site in her breast, that's the part of the breast the surgeon biopsies. We are now able to do the very same thing for men and able to do it without all the encumbrances, the expense, claustrophobia, and some of the other limitations of MRI scanning of the prostate.